So we have with us today Anita Karcz and Annette Cooke, both from ZurickDavis. They are great, interesting, knowledgeable people who have a lot of information to share with you. Anita is the Senior Vice President at ZurickDavis and brings her experience as a physician and a leader in various segments of healthcare. She's spent several years as a practicing emergency physician. She was active in hospital and professional society leadership. She's done research. She's done product development. She was on the founding team of 3 different medical device companies and has lots of experience on both the physician and the physician leader and the recruitment side. She's joined by Annette Cooke, Senior Vice President at ZurickDavis. Annette has been in the retained search industry since 1999 and has extensive experience recruiting executives, physicians, and nursing leaders internationally. In addition to her search expertise, Annette has worked with both the NHS and the private sector advising on nursing recruitment strategy and retention. So I'm excited to have both of them here today, and we hope that you have a great time, ask lots of questions, and I will turn it over to Anita and Annette.
Thank you. We do appreciate the opportunity to be here. This is Anita Karcz, and hello, I'm Annette Cooke. And so we do thank you for taking the time to join us, and we do thank ACU for inviting us to present today. So I'm going to just, let me there we go, try to advance the slide. What we want to talk about today is a very important topic in healthcare today. Physician leadership. It's changed tremendously over the past years and continues to change rapidly. And it's really not so much, in the old days you would get the oldest physician or the physician who had been there the longest to head up and be the leader on the clinical side in an organization. Today, you do that at your peril because there's so much more required of physician leaders. And we're going to cover some of that in this presentation today. First of all, who are we? We are an executive search firm, and we only work in healthcare. We have 30 years of experience, and we have done a tremendous amount of work with community health centers and other organizations in healthcare. And one of the things that we have learned a lot about during our years of working in healthcare is the environment, management and leadership, and also we've learned a tremendous amount about physician leadership and the changes that have happened in that arena. Now, what is leadership? It's always good to define what you're talking about before you speak about it, although some people think that's not a prerequisite. Some of us do. So I like there are lots of definitions out there, and I like this one by Dwight Eisenhower, which is getting somebody to do something because he or she wants to do it. And really, leadership is an art. There are concrete skills that are a base and are required infrastructure for good leadership. This isn't something that you can just do off the cuff, if you know what I'm saying. Whoops. Let's see. Sorry about it. Oh, okay. I think I hit the, sorry about that, I hit the wrong button. So when you look at defining your leaders, there is the place you are today. And, we know what that is, and today there's a lot of shifting sands. And where do you want to be tomorrow? Do you want to be growing your organization? Is your organization expanding geographically? Are you adding new services? To decide what types of leaders you need to assess your organization. and your leadership structure. And also think about how will a physician leader fit into your team and into your strategic direction. And historically, as I alluded to before, a physician leader might have been the person who was around the longest, or they were a well-respected clinician who were promoted into a leadership role without formal training. But today, physician leaders make a choice. They decide that they want to do this. They want to serve in some of the roles that we have listed here on the screen. So often, they've got additional qualifications, such as an MBA or a degree in medical management, or a master's of public health, as an example. Now, when we think of physicians in the physician role, I mean, think about, and obviously some of this has changed and eroded over time, but physicians, classically, people went into medicine to have independence, autonomy, because they were scientists, and to rely heavily on peer respect and serve as the captain of the ship, you know, usually giving orders. And I think our classic image of that is the surgeon in the operating room. Now, today, physician leader, let me go back. Physician leaders, very different skill set and mindset. Shared history with clinicians in an organization, absolutely true. And the good thing is there's also this common language that comes from the clinical world. But communication and collaboration have become much more important, much more critical in this, for this new role. So recruiting a physician leader. Let's talk a little bit about what type of person lends themselves to this role, and how do you define who is the right leader to take you into tomorrow, who's also has the right hard skills, but also is culturally and strategically aligned with your organization.
So when we think about working in the community health center world, and really this does apply to any areas within medicine where there is an underserved population of people, what you're really looking for is a mission-driven physician leader. Clearly, that is an obvious thing to be able to spot. You will find physicians who have committed themselves to working within the CHC underserved space. So that's not a difficult characteristic to spot. You have physician leaders who are aligned with the values of both the community health center / underserved world, and also the leaders that work and have been some of the thought leaders in that environment. The issues when you come to find a physician leader is that the candidate pool is small. So what you have is a small pool of mission-driven physician leaders who understand how to navigate the community health center world, but often they don't have a lot of experience, and so they're getting experience on the job, which then means that they become extremely popular, and that creates very high levels of competition. And truthfully, we've done leadership roles and physician leadership work in both the urban and rural health centers, and to be honest with you, there is no difference. There are issues of competition in both areas, it just looks differently. And finally, what is really quite important is the compensation. And we'll just talk about that for a moment. So I think it's really important that as a community health center or like organization, you really do understand the market that you reside in, and you cannot think about necessarily what the health centre down the street is doing or in the next town over. What you've got to look to is, what are the premier organizations doing? How are they managing to attract really strong talent? What are they doing well? And what can you do even better than that? One of the things that we see sometimes in organizations where they are more financially challenged is that they feel limited. And this is something that we talk about a lot with them. Don't do that. Don't limit yourself. Don't limit your organization. Do your best to be competitive. We'll help you. We help our clients. You can get help thinking through what compensation structure should look like, what it can look like. You don't have to base everything any longer on a base salary. We see really innovative organizations who consider bonus payments. They're attached to revenues, patient satisfaction, and quality. They do sign-on bonuses, retention bonus payments. So there are ways that you can tie in the financial and quality and patient satisfaction scores and achievements and outcomes to the salary of your senior clinical leader. When you think about all leadership, really it comes down to two things, but it's especially pertinent with physician leadership because, as Anita said, they are scientists at heart. You've got the hard skills and you've got the soft skills, and both are equally important. What we always say, though, is that the soft skills are really the hard skills, because if you are a physician leader, you have achieved a certain amount of technical knowledge already. You've accumulated it. You've been successful. You've gotten through medical school. You've gone through your fellowship. You've done all the things that one feels is very important in terms of your technical skills and your qualifications. But most importantly is, do you have the soft skills, which again we think are the hard skills, to be a leader? And it goes back to the leadership slide that Anita referenced, which is about what is a leader. How do you inspire people? How do you get them to follow you? How do you get them to do what you want them to do? And that's really, really a very important element when you look at recruitment. You want a leader that has a vision. It's really important. Even if the vision isn't the right vision, it's important they understand how to have a vision, because things won't work out, but at least that they understand that they're moving towards something. They're getting people to move towards a common goal. So what is the vision? Well, they need to have, a very good, solid candidate will really need to have the ability to be able to define the landscape. We know the sands are shifting. We know it's moving really quickly. Everything won't be right. But they'll understand at least what are the key components that are happening and what really that means as they look to, as a community health centre looks towards the future. What is coming down the pipe for them, really. You want them to be ambitious and set ambitious goals, but they need to be attainable. They cannot be out of the realm, because that's not going to make anybody happy. You want somebody who understands how to direct, align, inspire, and focus. And again, that comes down to really, really all the soft skills. You want somebody who's going to be able to pull people along in a very cohesive, collaborative manner. And you also want a leader who doesn't overcomplicate making decisions. You need somebody who's able to make a decision. It's okay if it's the wrong decision, but they need to be able to make a decision. That's really important. What does it mean to operationalize the vision? Well, you need to be able to communicate it, first of all, so you do need a strong communicator. You also, as a physician leader, do not want somebody who only can speak clinical speak. You need somebody who's going to be able to work equally well with the senior level administrators, the mid-level administrators, as well as the physicians and the clinicians. It's really important. You want somebody who immediately can start gaining credibility. How do you do that? Well, you start by making sure that this person does what they say they're going to do. They build loyalty, they build trust. There are going to be difficult decisions, there are going to be difficult conversations, That's just the nature of what is going on in healthcare today. So it's very important you have somebody who has the trust of their team, so that when they're communicating what is going on and what is coming down in the future, they're going to be able to have that buy-in. You want a consensus builder. We've already talked about the importance of being a decision maker. And you want somebody who comes to you with a track record of driving results, improved outcomes, whatever the area is. It can be financial, quality, satisfaction. It can be physician satisfaction, patient satisfaction, engagement. And you want somebody who holds people accountable. It's very important. A lot of research recently has come to light about people wanting a very consistent leader, not being unafraid that no matter what happens, the person is going to be steady, and they're going to be the person that keeps the ship on track even through difficult times. So it's very important that you are able to interview around consistency and really steer clear of people who seem to present or have a track record of being more an erratic personality.
And, you know, Annette, I think one of the key things around what we talked about here with vision is having the vision is important, but there are so many people, not necessarily in the physician leadership space, although I have met some, who see the vision. They can talk to it, they can lay it out, but they can't operationalize it. They can't take the next step and make it happen, which is critical.
It's very important, and it's really, really important in the community health center world, because you don't have a large team of people. You just can't be the thought leader in the ivory tower.
Right.
As Anita said, you've got to understand. You've got to be able to get into the nitty-gritty of sometimes the financials, certainly the clinical world. You need to be able to hold people accountable, and you can only do that with a lean team when you're able to really understand what's going on and not just direct. So.
Absolutely. So what else might do physician leaders need? Functional skills. And there are a lot of these, and different people have them to different degrees, obviously. One of the key things today is familiarity with information technology and EHRs. This has become a fact of life, and I know, it's a love-hate relationship, but you have to have that. That's important. The other piece is multidisciplinary teams, working with people from different disciplines and being able to lead those teams effectively. The us versus them mentality, which unfortunately, I think was sometimes you would see with physicians, let's say in a hospital setting, would be physician versus the administration. That doesn't work anymore. The adversarial, the physicians versus the nurses. Everyone has to work together, and whoever is a physician leader needs to sort of herd everybody together and get them working together efficiently and effectively. And the other thing is, Annette referred to building credibility. And I think this is key in terms of physician leaders. And, there's a lot of discussion about whether physician leaders should always work clinically. And I think that's, you can say a lot on each side of that equation. It's one of those things that probably the other things you do are more important for your credibility than your seeing patients one morning every couple of weeks. Subject matter expertise, and again, this is where a practicing physician will not necessarily be familiar with all of these other bodies of knowledge that are really part of the armamentarium of a physician leader. Population health management. We talked about information technology, palliative care, economics and finance. Obviously, a physician leader should not have to go down to the nitty-gritty and know what you get paid for what CPT code, but certainly has to have an appreciation and a grasp of finance and of some of the financial implications of certain regulations that have come forth, such as value-based purchasing. This becomes very important in terms of survival of organizations and will become even more critical and more important going forward. And the interpersonal skills, and again, we think of these as the soft skills, but they're absolutely critical. Teamwork, empathy, customer service is very important. You know, how does the physician leader look at how patients are treated who come to your facility? Conflict management, critical point. Performance feedback, how do you, being able to work with folks and say, you did a really good job on that, but we really need to improve your skills in process management or in your interactions with patients, as an example. And understanding and respecting cultural and economic diversity and skills of other practitioners. And really, when you come down to it, I mean, when you look at the interpersonal skills, it all comes down to understanding and respect, whatever the framework might be that we're talking about here. And emotional intelligence. This is a term that has been out there for quite some time, and I'm sure you've heard of it. And it's really, how can you express your emotions and be aware of them, and to handle interpersonal relationships. And all of these skills are very important and really require a leader to be thoughtful, to consider the implications of his or her actions in light of relationships with others and relationships within the organization. So what do you do? How do you find them? And what makes sense? Should you develop them within your organization? Recruit? Do both, perhaps? And we can certainly talk about pros and cons of each of these things. But let's talk a little bit about how you might want to talk about developing leaders from within an organization.
So when you are thinking about recruiting a physician leader or recruiting from within, so it doesn't matter, what you really need to do is take a look at your organization. Who is currently in your organization that is in a position to step up, maybe with some additional training, but who has the right temperament in order to step up and perhaps be a leader? Looking at their readiness. So maybe they're a little green, but maybe they have some natural leadership abilities. How ready are they, and what can you do to help them? If they have natural leadership abilities, it's going to make it much, much, much easier. But regardless, you are going to need to do some work with that person. So really understanding and probably working very closely with your HR leaders to really understand the type of training and opportunities that an internal candidate needs to further develop so that they can become a solid leader. It's a very good way. Growing from within tends to be very successful. It's a very good route to go if you have somebody that is a potential leader already in place. It also saves, believe it or not, a lot of money in the long run because you are not recruiting and refilling positions. So it is a very, very good way of taking a look at your organization.
And a piece of that is nurturing people. I mean, you really have to have a commitment. This is not something you can do in 2 months. It has to be a long-term commitment to say, okay, we think, so-and-so has potential. Well, let's give him or her leadership of a certain project.
Mm-hmm. Yep.
And support them, maybe surround them with some other more experienced people to help guide and coach them, but to let them, learn and get their feet wet.
Correct, because it's an investment. You're investing in them and they're investing in you. And a really good way that we have seen physician leaders grow is, as Anita said, putting them in charge of a project, or putting them in charge of some program that you have at the health center or some quality initiative is a good way to see how people deal with a micro situation. It's a pretty good indication of how they're going to lead in general, even though it's in a much smaller environment. As you bring in a candidate, it's the same thing really, except that you've got to be more honest with them. The person who is already in place knows what's going on in your organization, for good or bad. It's really important that you can be honest and really provide an accurate assessment of your organization. It doesn't really matter, honestly, what is going on. We have organizations that need unbelievable turnarounds. The right person will not be afraid of that, but they do want you to be honest with them. So you want to be honest with prospective candidates about, does your organization have a good reputation? They can find this out very easily. How aligned are your leadership? Healthcare is small. People will know people who've worked there, have working there currently. There is a solid network of people within the healthcare space. So you want to make sure that you have either an aligned team or a plan in place to get your team aligned. And if bringing in the new CMO is the way to do it, that's fine too. Again, it's just being honest. Really important to people, to individuals who want to be prospective candidates in the underserved world, is what are the values and culture of your organization. A lot of times people want to work in a particular culture because of its values and its mission. They can forego, a salary or, opportunities for advancement in other organizations more quickly, but they really do want to know that they are joining an organization that is ethical, that has strong values, and that has a solid culture in place. It's being led at the C-suite. They want to know if you treat your employees fairly, and do you treat clinicians and non-clinicians the same. That will be important to them. As they come into interview with you, they'll want to understand what are the critical success factors of the position. What are the things that you as an organization want doing within the first sort of 18 months? What are the goals? Can they achieve them? They'll want to understand how this position will strengthen his or her professional value. Is this going to be a situation where in 3 to 5 years they can look back and feel that they have accomplished something and feel good about it? Are they going to be able to learn? Physician leaders are very concerned about continuing professional development. It's very important to them. One of the things that they may consider as they look at the role is, how is it going to be perceived from the outside? Is it a good step up? Is it a title that will be perceived as a growth step? It's important because as they consider the move after this one and the one after that, if they're young, they're going to want to make sure that their resume really reflects that they have done the work to contribute to a very solid career trajectory. And then at a C-level role, what is the visibility of the position? So are they an ambassador? Are they going to be an internal ambassador, an external ambassador? What is their role vis-a-vis the other C-suite positions within the organization? How do they interface? From the physician perspective, they're going to want to know how cohesive, how collaborative is the physician team already in place? How well is that relationship with the other clinical people on staff and administrative leadership? Again, if these are areas of concern, it's actually fine. Just bring them up and be honest about them. You don't have to have a smooth running ship to hire a really great CMO. They'll want to look at your quality, your performance programs, what are you doing, what are your outcomes, how active are they, who's on top of them, historically, what has been your performance, and what areas need improvement, because that will help them understand where your priorities are as they come in. And really importantly, can they make a difference? Most people want a position where they can make a difference. And so it's important that you're able to demonstrate that them being in place is going to make a difference to your organization. When you bring in somebody from the outside, there are some obvious red flags, and here they are. They're very obvious. If you've got high turnover at the executive level, difficulty recruiting top-tier talent. So if you have C candidates in your top-level positions, that's going to be concerning to them. If the staff have got poor morale, if during the interviewing process they pick up things that are alarming to them, that is going to be a very hard sell, along with if you have poor quality indicators. These are the really, really difficult things for position leaders to move beyond. I can just, just from our experience, we can tell you, these are the areas that they focus on.
But I think your point, Annette, about being honest is really key here, which is, let's say you have let's say your organization has a problem with staff morale. Well, the way to handle that is to be upfront with the candidates and say, one of our big concerns is morale of our staff. We need whoever takes this position will have to work on that.
Absolutely.
And you have our full commitment.
Absolutely.
Because I mean, I think no place is perfect.
No.
So
what you don't want to do is them to find out, is the candidate, your ideal candidate, to find out during the interview with the staff that morale is poor.
Right.
They want to walk in knowing that and hearing that from the CEO or the VP of HR.
Yep.
Or whatever. Just being honest is going to serve you a lot better. Because the right candidate will look at an issue that you want resolved as a challenge and not an obstacle. But you just, again, it's really important that you're out there and you're just letting them know where you're at organizationally and what your expectations of them will be. When you bring in somebody, and we really speak a lot to our clients about this, using a structured guide is really, really helpful. So if you have 2 or 3 people that you're bringing in for a CMO position, make sure that you have the same stakeholders ask the same questions. So if you want to have a question around, for example, your leadership style, have the same person ask that question of all 3 candidates so that they have a benchmark data that they can contrast and compare and come up with a value so that they understand how the candidates have contrasted and compared against each other. It's a really important way, and it's a really easy way to go off track. Everybody gets seduced by candidates. This is a way of keeping it fairly objective as much as one can. Learn about the candidate's accomplishments. Ask them difficult questions. Drill down. Make them ask these, some of these are behavioral questions, right? So make sure you get them to talk about a difficult leadership challenge. There's not a single leader that has had it easy all the time. Make them talk you through what their challenge was, what they did, how they addressed it. We do an SBAR when we interview, give us the situation, the background, the action you took, and the results. And very, very quickly you will come to see whether somebody's able to articulate what they walked into, how they dealt with it, and what the results were. You want to be able to ask them to talk about, again, as Anita mentioned earlier, the interdisciplinary work. Now a lot of healthcare is not being delivered by physicians, so how are you using other providers within the setting that you have come from? There is still, although it is going away and waning, there is still the issue of the physician is there to sort of, the CMO is there to beat up the other physicians. And really that's not the case anymore. It should be a very solid and collaborative and cohesive relationship. But there are going to be situations where the CMO has to speak with a physician about something that they have done or said, and how do they handle it, and how successful were they. And then you want to talk to anybody who's walking into a leadership role about how they drove organizational change. What did they do? How did they do it? You know, what were the results? Again, this is more of a long-term achievement, but you're just getting an idea about not necessarily what the person did, but how they did it. When you look at references, you know, there are many things that you can gain from references, and sometimes it's what people don't tell you that actually is most important. But you want to understand from a reference, you know, the person's style. Again, not necessarily what they did, but how did they do it? So how did this person drive people towards a common goal? What is the reputation? You know, are they respected by their peers? The new position is a step up for them. It's a big role. Can you comment on, you know, this person's ability to scale up? These are things that you should be asking. You're just trying to get the best holistic picture of a candidate that you possibly can as you look at the evaluation. On the other hand, and this is just a fact, nobody's perfect. There is not going to be a perfect candidate out there. You may as well acknowledge that up front. So you want to understand what it is that you can live with. So a great reference question, in my opinion, is how would a fair-minded critic, what would a fair-minded critic say about X? I think it's a really good way for somebody to be able to discuss openly a situation where the person perhaps didn't handle something as well, but also it's done it in a positive light. Have you seen this person in an environment where they didn't get along? How did they handle that? You know, you do want to be aware for a C-suite position and a CMO position, if there's anything that a reference knows about that you would want to understand, because you don't want anybody causing your organization any kind of embarrassment, or you don't want a candidate to be embarrassed by something that comes out. Quite often when we're interviewing people and we're looking at references, I will say to the person up front, am I going to be surprised by anything? Because you may as well tell me now. And sometimes people say, well, there is this or there is this, but you know, this is how I resolved it. Some people get nervous around you know, certain periods in their career. It's understandable. We've all got our enemies. So you have to just take the references as part of the decision-making process. When you look at a candidate, the red flags for them are if they have repetitive short tenures at multiple organizations, it's definitely a red flag. There may be very good explanations as to why they left somewhere. You know, they've had 6 positions in 4 years. But truthfully, that ultimately, even if it wasn't their fault, comes down to their judgment call and not being able to assess the situation accurately. You want to make sure that they don't have poor judgment. How do you know that? Well, you can do what you can through the interviewing process. But the minute they start not taking responsibility for their actions and their role in why something didn't work, that is a red flag for us. And you don't want to fall into the trap of, well, we've interviewed 3 people and we've contacted 500 and we just can't find somebody. You will find somebody. It takes time, it takes skill, but you shouldn't settle on a candidate that is subpar, because that is not going to help anybody in the long term. And actually, all the research and evidence demonstrates that it has a very negative connotation and carries a lot of consequences for your organization.
So what we've tried to do here is, in obviously a brief session, give you an overview of how you might evaluate or develop physician leaders and what is required. So the hard versus soft skills are important. And I think, you know, what's their philosophy of leadership? What do they see as their role? And again, how does this person fit with your culture? When you look at this as a candidate, really the resume is only 20%. Obviously, you're looking for certain experience, certain professional degrees, training, appropriate licensing, haven't been, medical license has not been revoked, that sort of thing. But really, you're looking for fit. You're looking for this person to be a successful, integral part of your organization, which is a big order, okay? That it's not easy. If you're just looking for a warm body, that's a whole nother story. Mm-hmm. But as Annette said, leaders, if you settle for people, it's not good. It will have a damaging effect on your organization. And just a couple of words. This is a word cloud that we've created, which really based on asking our clients how they described us. And this is something, to think about in terms, I think a word cloud is a wonderful graphic. It's a wonderful visual. Looking at it gives you a lot of information very quickly. And it's something to think about in terms of, terms that might describe how you're doing in terms of, let's say, serving your patients, serving your clients that come to you. It might also be a way to evaluate a potential physician leader. What terms do people think about? You've now all met this person who's come around. Give me, I don't know, 5 to 8 words that you would use to describe them. And then, there are lots of places online where you can plug a list into a site and come out with a word cloud. So it's something to think about, just as another way of gaining some insight. So I think we've pretty much covered what we would like to talk about. I think we're at this point open for questions.
Great, thank you. Thank you so much. We appreciate all of that. Really interesting and valuable. We appreciate you giving this webinar. For those of you on the line, they also do their own free webinar series, so you should check out their website to find out about that. And we've been getting a lot of requests on this topic because obviously we see, the health center care team as more than just physicians, but finding that right physician leader for your CMO position can be a real challenge, as you've demonstrated, but if you do the process the right way, can really lead you to success. So I'll invite some questions. We have a few already, but I will invite anybody else, if you have some question lingering in the back of your mind, to feel free to go ahead and put that in the questions box. But the first question we have for Anita and Annette is, in developing internal physician leaders, what types of training programs are most effective?
Well, that's a big question. I think that there are many ways to train people, and a lot depends upon where they might need additional training. You might want, there's everything from a one-day conference to an executive master's program. Mm-hmm. So it's really all over the map in that regard. I think that there is the American Association of Physician Leaders that does a lot in terms of physician leadership education. So I think that that's a good place to start. And also, even though you might have a physician leader, a lot of the leadership programs that are, let's say, focused on non-physician leaders or leaders in general in healthcare can also be very valuable. The American College of Healthcare Executives comes to mind, et cetera.
Correct. And the other thing is that, on an informal level, you can also, if you have somebody that is that is within your organization that you're trying to develop from within and professionally develop from within. You know, a good idea that we often encounter is have that person get a mentor, help them find a mentor. A strong physician leader, somebody who's very well respected in your geography, and that person can operate as and act as a mentor for a young and up-and-coming physician leader.
Mm-hmm. Yes, absolutely. And I think, you know, the other key that comes to mind is outside committees. Mm-hmm. So, for example, your organization might be part of a consortium looking at a particular health issue within your region. And usually representatives need to participate in those committees. Right. And again, those are good ways to get somebody getting a sense of you know, getting background and also a sense of the broader landscape. You know, what's going on regionally with other like organizations. What are the issues and problems?
Yeah, correct.
Great, very helpful. Next question we have is sort of touching on the mentorship relationship you mentioned. Any advice for young physician leaders who are supervising senior experienced physicians?
Well, I think one of probably the real issue there is how, you know, there can sometimes be some interpersonal difficulty depending upon the personalities involved. Okay, so let's not pretend that this can always be easy. But if the younger physician who is supervising is, again, understanding and respectful, collegial rather than I'm the boss, you know, that goes a long way, I think. And, you know, also, I mean, when you think about the older physician who at this point is probably feeling like everybody in the world is telling him or her how to practice medicine these days, okay? So there's a lot of sort of kerfluffle there in terms of emotion. And I think, you know, once those things are acknowledged, and plus some of it, again, is, you know, timing is over time, you know, that you can't win somebody over in one 15-minute session. You need to do that by being steady and consistent and respectful, working together over a period of time.
Absolutely. You know, this is fairly common in the clinical informatics area, and when you're looking at in the IT space today, it's not uncommon for a CMIO to be a very young physician who has had, you know, who has an additional degree in clinical informatics or some kind of IS systems, and has been given the role because the organization wants to change how technology is being optimized, and this is not an uncommon situation. But I think understanding, for those young physician leaders, understanding that perhaps the, you know, physician leader who's 5 years out from retirement is really struggling with this new world, but that doesn't negate that they may be an excellent clinician and they have their own areas of expertise. So trying to engage them in the areas where they're experts and not focusing just completely on how to change behavior, I think is one of the key areas to take a look at. But that is an area where it's incredibly common, incredibly common.
I'll actually share a very brief anecdote, which is years ago when I was at an organization in the hospital that shall not be named, and I was new there in the emergency department, and I was told that this one attending physician who was one of the full-time staff in one of the internal medicine subspecialties was a holy terror, and that he was going to basically make my life miserable. So I decided, well, I had nothing to lose, so I went and had a meeting with him. And interestingly enough, I looked on the wall, and it turned out he did his residency at the same place I did. So at that point, we bonded and became best friends. Now, not to say that always happens,
Right.
but that's the thing I always remember, which was, you know, was I nervous going into his office? Sure was. But, you know,
right. Finding common ground.
Finding common ground.
Can you all, it's extremely helpful, can you maybe illuminate a little bit the relationship between CMOs and dental directors and kind of how maybe a reporting structure at a health center can be important when you're considering who to recruit and how to set up your CMO leadership system?
So can you just be more specific? How would you have the director of the dental program report to the CMO, or you're asking if that would be a good reporting structure?
I'm asking the latter, yeah. Some health centers have dental directors reporting directly to CMOs depending on the size of the health center. Some of them don't. Do you have any insight into how the medical and the dental directors and leaders maybe work together or don't work together so well?
We've seen both variations on the theme, and I would be hard pressed to say that one works better than the other. I think that it really, a lot, quite frankly, depends upon the, the bandwidth of the person who has to be reported to. Mm-hmm. So if the chief medical officer already has a million things on his or her plate, it might not be the best, reporting, to have the dental director also report to him or her might not be the greatest thing.
Absolutely.
But I think it's really kind of an individual preference.
And it depends, and when Anita talked about bandwidth, it's not uncommon in some very small community health centers that the CMO is only part-time, and you have to take that into account.
Right.
I will tell you that model is becoming less successful because the administrative and leadership piece is becoming so much more important that it's getting more difficult to do that job on a part-time basis. But that is something to take into consideration. And what do you have for nursing? Do you have a nursing director? Do you have a chief nursing officer? It really depends on the structure of the actual environment.
Okay, great. Very helpful. We have another question here. Are there established intern programs that centers could send potential candidates through to identify and build internal candidates for physician leadership?
I am not personally aware of any.
I'm not either.
No.
I'm not either.
That might be, actually, it's too bad. That would be a very interesting question. Maybe in the, in the follow-up to this webinar, if you're sending out an email to people, to ask if they either have that or know of them, because I quite honestly, we don't know.
I've never heard of one. That doesn't mean they don't exist, but.
Okay, well, definitely we'll do some research here at the STAR Center and share out anything that we can. And, of course, if anybody on the line is working with anyone, we would love to hear about it. And as we're wrapping up time here, we have just one more question for you, which is if anybody on the line who's at a health center has 1 hour to revamp their CMO recruitment process, what would your recommendations be? Where should they start? What should they do with that 1 hour?
You want to take this?
Oh my goodness gracious! I don't even know what one can do within an hour. Actually, I think that if you're going to go down the route of recruiting, you need to be organized, and so I think that the way to start recruiting is to network and to call people you know and call respected leaders in the community. I don't believe that just blanket throwing something out there is going to work, not in this environment. And then as you bring people in, you have got to address some of the issues that are facing community health centers around compensation and around giving somebody a positive experience. Remember, all recruiting it's a two-way street. You know, it is a buy and it is a sell, and I would remember that all the time that you're thinking about your recruitment, and just keep things organized and tight down to the evaluation, through the interviewing process. All the things that we talked about today, you can pretty much put together a quick plan in an hour. But in terms of the actual recruitment, I think you have to start with people that you know and go from there.
Great. I can't echo and say amen enough to what you're saying about a plan. For those on the line, we do have a recruitment retention plan coming very shortly, soon, as it clears Bureau review process. We're going to have a few webinars dedicated to it later in the year. But really, I think getting organized from the start and using what precious little time you have to put to paper some of your plans and processes is a really great place to start and start seeing different results. I want to say thank you so much to both of our speakers for their time today and this great information, and thank you to all of you for joining us. The recording will be available, as well as any information we get on some follow-up for these questions, on our website, and you'll get it via email. So thanks so much. Please look for more information on next month's webinar, and we're here anytime to help you.
Thank you so much for the opportunity. We appreciate it.
Yes, thank you.
We had fun.
We did.
Hooray! That's what we're always aiming for here at ACU. Thank you all. Everyone have a great day.